Today we're covering a critical topic for your phlebotomy exam, the proper handling of light-sensitive specimens. Failing to protect these samples from light is a major pre-analytical error that can directly impact patient care, and you can be certain the exam will test your knowledge on it. The core concept you must understand is photodegradation. Certain analytes, when exposed to light, break down, leading to falsely low test results. This isn't a minor fluctuation. Exposure to normal room lighting can cause significant decreases in analyte concentration, compromising the integrity of the specimen. Your exam will expect you to know exactly which common tests require protection from light. The most frequently tested light-sensitive analyte is bilirubin. This is especially critical for newborn screening for jaundice. A falsely low bilirubin level caused by light exposure could lead to a misdiagnosis of severe hyperbilirubinemia, which has serious health consequences for the infant. Other important analytes you need to memorize are vitamin B12, vitamin A, beta-carotene, and porphyrins. Some drugs, like methotrexate, are also light-sensitive. The exam will test this in a few ways. You might see a direct question like, which of the following specimens must be protected from light? And you'll have to choose from a list that includes options like bilirubin, potassium, or glucose. Or, you could face a scenario question where a newborn's bilirubin level is unexpectedly low, and you must identify improper specimen handling, such as failure to wrap the tube as the cause. The correct procedure is non-negotiable. You must either collect the blood in a special amber-colored, light-blocking tube or, more commonly, wrap a standard tube completely in aluminum foil immediately after collection. This protection must be maintained during transport to the laboratory. A common exam trap is to confuse light protection with temperature requirements. The exam might present a scenario with a test that needs to be on ice, like ammonia, and one that needs light protection, like bilirubin, and ask you to identify the correct handling for each. Remember, they are distinct requirements for different tests. The most critical trap to avoid is misunderstanding the result of photodegradation. Light exposure always leads to falsely decreased results for these analytes. To help you remember the key light-sensitive analytes, use this mnemonic. Be very aware of bright rays. This stands for bilirubin, vitamin A, vitamin B12, beta-carotene, and related compounds like porphyrins. When you see a question about specimen handling, think be very aware of bright rays to recall which ones need to be wrapped in foil or placed in an amber tube. Mastering this concept is essential, as it demonstrates your understanding of the pre-analytical variables that ensure accurate and reliable test results, a cornerstone of professional phlebotomy practice. For free practice questions, AI-powered explanations, and more exam prep tools, visit openexamprep.com. That's openexamprep, all one word, .com.